most common reason for total joint replacement is arthritis. So we have a three-dimensional model of a knee with arthritis. So I want you to tell us what's going on.
So with osteoarthritis is a loss of cartilage. Generally, that's osteoarthritis. So cartilage is the cushion or the thing that separates bones in between an interface. We'll see here, this is a knee model with the femur bone, tibia bone, and the patella bone. And this white shiny surface is the articular cartilage. With osteoarthritis, we start to lose the content of this and it starts to fragment or break off. There's an inflammatory process that occurs, and eventually it wears away and you get bone touching bone.
All right, now we have another graphic here that I want people to look at. Is according to the National Institutes of Health, there has been a dramatic increase in the number of total knee replacement procedures in some age groups, as a matter of fact, more than a 200% increase. Now, knee arthritis may be to blame in younger patients, but more knee injuries and a lot more obesity in our society, quite frankly, are most likely. These are called the main culprits.
Obesity is probably the main, what we would call as modifiable risk factor. These are things that you as a patient can do to prevent yourself from developing or the progression of osteoarthritis. There's many things that we cannot control. We can't control what our parents have given us in our genes, but injuries and weight are the main things. Specifically obesity for two reasons. You have to think about the mechanical load with the forces that go across the joint. And if you think about the knee, with certain parts of the movement of the knee, we're seeing 6 times the body weight. So 1 pound on your body is 6 pounds across your knee. And if actually you do the math, most people take about 3 million steps a year. And if you lose 10 pounds and you keep that over 10 years, that's over 1 billion pounds of force that goes across your knee. The second thing that obesity leads to, it leads to a pro-inflammatory state in our body. Our body generates more inflammation, and you'll hear from other health segments about the role of inflammation, especially on the heart and the vascular system. Well, it affects the musculoskeletal system as well. And we know that people who are obese or overweight will get arthritis in parts that don't have a huge load, like in the thumb joint and other parts. And so weight control is by far the most important thing for helping to prevent the progression of osteoarthritis.